and tonight we're going to be talking about deworming practices for beef cattle. If you have questions as we go, please feel free to just put them in the chat, or you can unmute yourself at the end. That's fine too. We're pretty informal. So with that, we're going to go ahead and get started. So just to kind of refresh our memories, most of us are pretty familiar with some of the impacts that parasites can have in cattle, but obviously they can have implications for cattle health. They do pose health challenges for our cattle. They can serve as disease vectors. They can cause physical harm to the animals, and they can cause significant irritation to them as well. And of course, all of those things have impacts on our economic return as well. A lot of those things can reduce feed intake, which can subsequently reduce our production, as well as our reproductive performance in some of our females as well. So they're important in terms of economics. There are two main categories of parasites that we oftentimes think of. The first category is the external parasites, which include flies, lice, ticks, and grubs, and things like that. And then we also have internal parasites, or our gastrointestinal parasites. And those include nematodes, or roundworms, cestodes, or tapeworms, and trematodes, or flukes. And the one we're going to focus on tonight is going to be mostly the nematodes, because those are the most economically important internal parasites to our cattle. Before we get too far into this, I do want to mention that livestock will never be 100% parasite free, and cattle will naturally carry a parasite load. And they can cope with the presence of some parasites, but our goal really is to reduce the parasite load to a point to where the animals can cope and do well, and make sure that the parasite load isn't getting out of control. So we minimize any impacts on health and performance. So again, our goal is not to eradicate the parasites from our animals completely, but just to manage those parasite load to an appropriate level. This is the life cycle of the brown stomach worm, which is probably one of the most economically impactful internal parasites in cattle. And this is just to show you kind of how cattle become infected. So they will graze grass that has the worm on them, and so they ingest the worm. The worm will go into the animal's intestinal tract or digestive tract, and it will mature there. Then it will lay eggs, which are deposited in the feces, and then the eggs will hatch, and the larvae will mature. And it takes a couple of weeks before they become infective again. So for this particular worm, they become infective at around 2 weeks after they're passed into the manure. And that's an important thing to note, because that can help you make management decisions in terms of, pasture rotations and treatments and things like that. But it's important to note too that a lot of these eggs will actually be able to remain dormant for a very long period of time if weather conditions are unfavorable for them to survive. So they'll stay dormant if temperatures are too cold, or if there's a severe drought and things like that. So that's just something to keep in mind with our worms. Now I'm going to go through a couple of the significant nematode parasites for our cattle. The first is homunculus, and that is a parasite that adult cattle can become immune to, but it can cause problems for calves if they become if the parasite load becomes too high, and it can cause anemia in our calves. The big one that we always think about with cattle is the brown stomach worm, or Ostertagia. This is a parasite that will affect our calves less than 15 months of age. And what this worm does is it affects the acid producing cells of the abomasum, which is the fourth compartment of the stomach, or the main true stomach of the cow. And it will alter the acid producing cells so that they don't function properly, which can cause protein malnutrition and things like that. And obviously that can have some impacts on our calf growth, as well as their health. They'll have a rough hair coat, they can have diarrhea, weight loss, and they can also have significantly reduced feed intake. So that's a big one that we try to avoid. And then the last one that we encounter in cattle a lot of times is Cuperia. This is a parasite that will infect the lining of the upper small intestine, and it's when generally smaller loads are not a problem for our cattle. But it's when they have large infestations, that's when we start to see problems. You'll see weight loss and poor production, but unlike homunculus, you generally won't see anemia. So no talk about deworming would be appropriate without talking about this issue of dewormer resistance, which you may or may not have heard about. So dewormers have been around for many years, so since the 1950s, and no new classes of dewormers have been introduced in over 40 years. And because of that, resistance is starting to become a problem. Resistance is classified as a lower than expected dewormer effectiveness when other causes are ruled out. So things like user error, underdosing, and things like that. Those are not the reason. It's because the drug is becoming less effective. Why is that? So traditional approaches to deworming were to treat every single animal multiple times per year. The problem with this is that a population of resistant parasites will survive each application and reproduce. And those resistant genes are passed from one generation of worms to the next, and that results in a greater proportion of parasites that are resistant to the dewormer that's being used. And so unfortunately, that traditional approach has been artificially selecting for parasite resistance. This figure illustrates that a little bit for folks who like a little bit of a visual. In the left-hand side, we have a situation where a dewormer is completely effective. So the blue squiggles are representing susceptible parasites, so ones that the dewormer will work against. And the red are the resistant parasites. So in a normal situation, when the dewormer is effective, we can see we treat the animal, all of the blue squiggles are gone. That means that the majority of the parasites have been killed by the dewormer. When we get into a situation where our dewormers become less effective, what's happening is we have more of these resistant squiggles inside the animal, but some of those resistant parasites are also being passed in the manure and put out into the pasture. And that's a problem because then other animals will pick those up and make the problem worse. And then, of course, when we have a situation where there's complete resistance, most of the parasites inside the animal are completely resistant to the dewormer, and you basically don't have an effective deworming program happening. So again, we really want to try to reduce the effects of resistance on our farm. So unfortunately, overuse and inadvertent misuse of dewormers over time has contributed to the development of this parasite resistance. And this obviously has implications for our animal health as well as our farm economics. And it's a significant problem for the small ruminant industry. For any folks who are familiar with the sheep and goat industry, they have issues with dewormer resistance, and they have for quite a long time. The parasite that's most important for them that they worry about is called the barber pole worm, or Homunculus contortus. And this parasite will cause large noticeable impacts on the animal. So it can cause severe anemia, and it could even cause death in certain cases. So they have a problem when they have dewormer resistance because they don't have anything that's effective to treat those animals. So what they have had to do is implement alternative alternative worm management strategies. Resistance is present in cattle, but it's much less noticeable because the parasites that have developed resistance are not as economically impactful, and it's not widely present in species that are significantly impacting our performance yet. There have been reports of many of these different nematode species being resistant to dewormers across the globe. So in Europe, there have been reports for Capiria and the brown stomach worm to be resistant to dewormers. In the US, it's been reported that there's resistance to Capiria, Capiria is resistant, as well as Homunculus species. And then we did a study a couple years ago here in Maryland, a very small survey study, and we did see some suspect resistance developing in all three of our nematode species. So it's here, it's just not quite as widespread to the point where it's as noticeable as it is in the small ruminant industry. I mentioned the study that we did a couple of years ago. Just to give you a little bit more context with that one, we went to 14 different farms, and we took manure samples from 17 groups of animals, and we tested the efficacy of different dewormers. And only 3 out of the 17 farms or 17 groups of animals that we tested, we had had what we considered a good deworming treatment. So overall, what we saw was only a 60% reduction in egg count or parasite load from before versus after deworming treatment, and we considered 95% to be our goal. So again, this is all this to say we do have resistance going on, so we need to do everything we can to help mitigate that. So because of that, what we think going forward for parasite management is we need to take an integrated approach. So integrated parasite management involves 3 different pieces to help us manage parasites on our farm. We have the animal piece. So we want to make sure we're providing our animals a nutritious diet and making sure that they're as healthy as possible so that they can cope with parasites when they're presented with them. We have pasture management, which is a huge component of parasite management. And then we also have our Judicious Dewormer Use, which is what we're going to focus on for the rest of tonight. But I wanted to mention the other 2 pieces of our parasite management that are at our disposal as well. So as part of Judicious Dewormer Use, I've broken it down into 5 steps or categories, if you will, and I'll go into these in a little bit more detail as we go. So the first step is assessment of parasite load. The second one is the practice of targeted deworming. The third step is Dewormer Selection. The fourth is Dewormer Application, and the 5th is Dewormer Evaluation. So these are all segments of what we call Judicious Dewormer Use. So in terms of assessing parasite load, you might be thinking, like, what is that? Well, parasite load will vary significantly from animal to animal, season to season, year to year, and farm to farm. So what we want to do is get kind of an idea of what the parasite load is on the farm currently. So if the parasite burden so that we know when something becomes out of whack, when we know kind of when we should be deworming. So if a parasite burden of a group or a herd is high, we should consider maybe deworming our animals. But what is high for one herd might not be high for another herd. So that's why we suggest getting some kind of a baseline put together for your farm. And the way to do that would be to evaluate fecal egg counts periodically. So that is basically taking a sample of manure and sending it to a lab, and they will look at the number of eggs and count the number of eggs in that manure sample, and that will be correlated to the number of parasites inside the animal. So to do this, you might want to take 1 or 2 samples per year. You don't have to do anything crazy. You don't have to do like once a month or anything, but 1 or 2 times a year just to get yourself kind of a baseline to give you an idea of the parasite burden on your farm, and so that you can track changes over time so you know what's normal. And so how this works is you would basically send a composited fecal sample for a group of 15 to 20 animals. So basically you'd be collecting manure samples from a couple of different animals, mixing it all together, sending it to the lab, and then what they would do is analyze it for the number of eggs, and then they would get that result back to you. If you have less than 15 animals, it's a good idea to sample all of them. I'll talk about variation in a little bit, but that's kind of the target minimum number of animals that we like to see in a composite sample. And then that way, if there's a substantial increase relative to your baseline, some of the animals might require deworming. So that can be helpful in terms of making your decision whether to deworm or not. The next step in our judicious deworming, piece to our parasite management is something called targeted deworming. So the idea behind this is that not every animal in the group needs to be dewormed. So even if your baseline sample, you have your baseline and then your composite sample comes back and you have a high load, a parasite load all of a sudden, that doesn't mean every single animal in that group needs to be dewormed. As I mentioned before, all cattle on the farm will carry parasites, and that older cattle generally do develop a tolerance as they age to parasites. It's the younger cattle that are going to be affected by higher parasite loads. So there are higher risk animals. There's this old saying, it's called the 80-20 rule, where they say that 20% of the animals carry 80% of the worms. So if you think about that, that means that pretty much only 20% of the animals in your your group really are the ones that need to be dewormed. But the problem becomes then, well, how do we identify those 20%? Sometimes you can pick them out pretty easily, but then there's some that have a high parasite load that you might not even know because they don't look like they do. So that becomes our challenge, and that's what we have a couple of strategies here to help us with that. So as I mentioned, fecal egg count analysis is really the only way to know for sure which animals have a high parasite load. So what we can do is collect samples of manure from individual animals and send them to the lab for an analysis of the number of eggs. And the high number of eggs in the manure would correlate to a higher parasite load in the animal. Obviously, this is tedious, time-consuming, and expensive, and it's not very practical. So what we have instead are a couple of different selective, what we call non-treatment strategies. So choosing a few animals not to treat in the group. And the premise for non-treatment is to maintain what we call refugia. Refugia is a population of worms that remain unexposed to a dewormer. And basically, their purpose is to help dilute out the gene pool with worms that are susceptible to a dewormer. And it reduces the selection pressure for worms that possess the resistance traits. So if we look back to the figure I pulled up earlier, so refugia would be these blue worms that are in the animal as well as in the pasture. So if we leave a few animals not treated, we maintain their ability to shed some of these non-resistant parasites into the pasture, and those non-resistant parasites can be picked up by the other animals in the herd, and then they can prevent massive resistance from developing. So it's not going to stop resistance from developing completely, but it can help slow it and help maintain efficacy for a longer period of time. And it's the easiest approach we have to helping us to slow dewormer resistance on farm. So there are a couple of different strategies that we can take, and I'll present a couple of them to you here from least to most intensive. So the first selective non-treatment strategy would be to categorize animals on the farm according to their risk level. So those with high risk would be animals like calves, young calves under 9 months, any unthrifty animals, so animals that look like they're not performing well, they have rough hair or anything like that. Any newly purchased animals are also considered high risk. And then our moderate risk animals would be yearlings and cows in late pregnancy. And then our low risk animals would be our adult cattle. So we could categorize our animals according to risk and just deworm all those considered high risk. So for example, just deworm all of your calves and just leave your cows untreated. That's pretty easy, but it's not super intensive in terms of maintaining that refugia population and slowing dewormer resistance. If you want to take it up a notch, you could choose to deworm all of the animals in the high risk group, but leave a random subset untreated to help maintain that refugia population. So if you're deworming all of your calves, you could leave, say, every 10th calf untreated. Just decide, I'm going to count 10 calves. The 10th one's just going to be untreated every time. That's simple, and it's a little bit more intensive than that first strategy that I just mentioned. The third strategy would be to rank all the animals in the high risk group based on performance and leave the top 10 or 20% untreated. So this is a little bit more specific than the second strategy mentioned above here, because it's helping to identify those animals that really probably don't need to be dewormed. But the problem with this, obviously, it's a little bit more labor intensive, it's more complex, and it's not always practical to run them through the chute a couple of extra, an extra time to get that weight on those animals. And then the last most intensive non-treatment strategy would be to perform the fecal egg count analysis for individual animals in that high risk group and only deworm those with a high parasite load after you get the results back from the lab. This is the most impractical, but it is the most intensive and most accurate way to identify the animals that really shouldn't be dewormed. Before we wrap up with this targeted deworming part, I do want to mention that for any new animals coming onto the farm, they really should be quarantined and dewormed for 2 to 3 weeks on a dirt lot so that they are not bringing potentially resistant parasites onto your farm. And we recommend doing a combination dewormer treatment, and I'm going to talk about that here in just a minute, but we want to make sure that we're not bringing resistant parasites to the farm, to those animals. So a question that we get asked a lot is, when do I deworm? And that's kind of why you're here tonight, right? And unfortunately, as you might guess, that is not a very simple answer. So the answer is that it depends. It varies. When you should deworm your animals varies from year to year, depending on the weather, pasture conditions, different animal factors, the animal's physiological state. And so because of that, it's really important to avoid the temptation to deworm strictly by the calendar. And instead, consider performing a composite fecal egg count analysis for a group of animals on your farm to determine parasite load before thinking about deworming, just to give you an idea of whether or not deworming is even really necessary. For cows, though, everyone wants an answer, a solid recommendation. In general, cows do not need routinely dewormed. Generally, we recommend to do them on an as-needed basis. So if obviously she looks rough or she's having diarrhea or having other issues, she might be a good candidate to deworm. But just deworming them just because is generally not recommended, because I mentioned they generally will develop some type of tolerance or resistance to internal parasites as they age. Calves, on the other hand, are some of our high-risk animals on the farm. Generally, we can get away with deworming them 1 to 2 times a year. So maybe once, at 3 to 4 months of age, and then once at weaning. I say weaning because that's a stressful time for the calf, and when their immune system would be suppressed because of the stress associated with weaning, they might be more susceptible to a parasite overload at that time. So deworming at weaning is not a bad idea. But when you do deworm, it's good to still use those selective deworming treatment options that we mentioned earlier. The third step in our judicious deworming part of our parasite management is dewormer selection. So it's important to only use dewormers that work on your farm, that are not, the parasites are resistant to on your farm. And we'll talk about Dewormer Evaluation here shortly. But it's important to note that dewormer effectiveness will vary from farm to farm. So if one farm has an issue with resistance to ivermectin, another farm might not necessarily. It really depends on the farm. And parasite resistance against one class of dewormers does not necessarily mean that resistance exists against dewormers in another class. So again, we have to test it. Otherwise, we can't just make general assumptions for our farm. It's important to choose a dewormer with an application and method that is most appropriate to your setup and what's going to be easiest for you to administer to your animals. Pour-ons or topicals are really convenient and easy to apply. But the downside to those, obviously, is that absorption efficiency can be really variable depending on how it's applied, the animal's coat condition, the weather conditions, and things like that. Injectables and oral dewormers, on the other hand, are absorbed and activated more efficiently, but a lot of times they do require a bit more skill and labor, as well as supplies to administer them. So there is a downside to those as well. There are 3 different classes of dewormers that are used commonly in cattle. And so when I say, one class of, the parasites might be resistant to one class of dewormers, but not another. When I say class, this is what I'm talking about. So the first class is a group called benzimidazoles, and they function to disrupt the energy metabolism of the worms, and they target nematodes and flukes, and they can affect both the adult and egg stages. They're administered orally, and the common chemical names are fenbendazole, oxbendazole, and albendazole. And commercial examples are Safeguard, Panacur, Synanthic, and Velbazin. So those are some of the products you may have encountered. The second class of dewormers is called imidazole. And these function to cause paralysis in the worms, and they target nematodes, but they only affect the larvae and the adults. They don't have any effect on the eggs. They are administered either orally or as a subcutaneous injection, and the chemical name is called levamisole. So some of the trade names you may have heard are Levamed or Prohibit. And then the third class of dewormers, which I personally think is probably one of the most common one, is the macrocyclic lactones. And they function to cause paralysis of the worms, very much like the second class there. But they target the mature and immature nematodes as well as insects. So that's why part of the reason why this class of dewormers is so popular is because it does target some of our ectoparasites as well. Macrocyclic lactones are also longer acting than the other two classes as well. So that kind of makes them a little bit more of a popular choice from that regard as well. They are administered either topically or as a subcutaneous injection. And the active drugs include ivermectin, eprinomectin, doramectin, and moxidectin. And there are several different products and trade names that I've listed here that fall into this class, including Dectamax, ivermectin, Cydectin, long range, etc. So those are our three classes of dewormers. So if you're ever not sure what class it falls into, just look at the active ingredient. So the drug portion here, levamisole, fenbendazole, ivermectin, that'll help you determine what class it's actually in. Should you rotate dewormers? That's another question that is asked a lot. Actually, research has shown that rotating drug classes does not help to mitigate the development of parasite dewormer resistance. Instead, they recommend doing something called combination treatment if there is resistance to one class of dewormer in your herd. So what that would mean is you would be combining, say, a benzimidazole with an imidazothiazole, so Safeguard and Levamed, for example. That would be an example of a combination treatment. And the idea behind that would be that any parasites that are resistant to the one dewormer would be taken care of by the one that is by the second one that is effective against those parasites. So we help to prevent those resistant parasites from surviving altogether. So the fourth step in our judicious deworming program should be to administer dewormer appropriately. So it's important to read the label instructions very carefully to ensure that you are applying or administering the products the right way, that you're dosing the animal appropriately, and that you're also adhering to any residue warnings or meat and milk withdrawals. These are all very, very important things, so it's very, very important to read the label. As far as dosage goes, it's really strongly recommended to weigh animals individually, if at all possible, before deworming them, so you can accurately determine the dose that they need. This prevents underdosing, which inadvertently selects for dewormer-resistant parasites. This obviously underdosing is economically expensive because you're not applying a very effective dose to the animal, so you're not going to really see any impact on the animal. And it's also, obviously, as I mentioned, not good in terms of developing resistance, dewormer resistance. Using a scale is ideal, but if that's not an option, you can use weigh tapes, or if you really can't, you have no way to do it, it's always important to dose based on the heaviest animal in the group, not the average, because in that case you'll be underdosing half of the animals, but dose based on the heaviest animal in the group. These are just some residue warnings. Obviously, I'm not going to go through every single one of them, but some generalizations that I want to mention is that the benzimidazoles and imidazothiazoles, which are marked in red and blue, generally are going to have a shorter withdrawal period, meat withdrawal period, than the macrocyclic lactones. If you remember earlier, I mentioned that the macrocyclic lactones are longer acting. So you can kind of see that trend for a longer meat withdrawal for some of those dewormers. It's also important to note that if you have dairy cattle, a lot of these products are not approved for use in lactating dairy cows. So that's unfortunate, but they are still approved for use in heifers. So, so that's just something, again, to be mindful of when you're choosing a product to use. So the last part of our judicious dewormer use is dewormer evaluation. It's important to evaluate your dewormer periodically to help identify whether or not it's effective. It can save you money in the long run, obviously, if you're not using an ineffective drug. But it also helps to prevent further development of resistance, and it also helps to inform future deworming decisions and strategies. Evaluations are typically completed by you doing a fecal egg count reduction test. So it's a really long term, but it's a really simple procedure. So the premise of this test is to examine the number of eggs in the manure before and after deworming to get an idea of how much or how many eggs are being reduced by deworming your animals. The traditional approach to conducting a fecal egg count reduction test was to collect manure samples from every single animal in the group and submit each sample for analysis before and after treatment. Obviously, this is expensive and onerous and not very practical. A few years ago, there was a protocol developed to take a more economical approach, which is to collect manure samples from a subset of animals in your in a group, at least 15 to 20, and create a mixed composite sample from those animals and submit that for analysis. So you're only sending in one sample before treatment and then one sample after treatment. This is much less expensive. It's not really less labor intensive in terms of you collecting the samples, but it's less expensive in terms of sending a sample to the lab. It's not necessarily as accurate as the traditional approach, but it does, research has shown that it does relate really well to an individual assessment basis. So it's considered an acceptable approach to doing this test. So the first step in performing a fecal egg count reduction test is to select the group of animals that you're going to test. Ideally, you want to choose a fairly uniform group of animals on the farm to test. So you want them to be a similar age, that's the big one, similar pasture conditions, similar dewormer exposure, et cetera, et cetera. Because I mentioned there's so many other variables that can affect parasite load, we want the animals to be as similar as possible to minimize that variation in our test. And we want to try and have at least 15 animals per group. I know, if that's not always possible to have 15 uniform animals in a group. If you don't have enough, just be mindful that the interpretation and accuracy of the results can be a little bit challenging to make a sense of sometimes. It's important to weigh the cattle individually to determine their proper dewormer dose. So that's our next step after we select our animals. And then we would administer the dewormer to the animals and then collect the manure samples directly from the animals while they're in the chute or, however they're restrained to administer the dewormer. Collect the manure samples directly from the rectum and then store the samples in a relatively climate controlled cooler or something like that, especially if it's hot outside. If the samples get too warm, the eggs will actually start hatching and then the lab won't be able to count them. And that won't give you an accurate assessment. So it's important to keep them from getting too warm. Then apply the dewormer, I think I already mentioned that, according to label instructions. And then take your samples after you're all done with everything on the chute side, take your samples aside and composite them or mix them all together. Generally want to do this on an equal weight basis. I like to take like a little scale and just weigh out 5 grams of every sample and then mix it all together. And then you can send that sample to the lab. And then if you're sending these samples shipping them to a lab, you want to ship overnight and you want to keep them cool until you can send them to the lab. If you're shipping samples, it's a good idea to put an ice pack or something like that in the shipment so that, again, to keep the sample from getting too warm, especially if it's summertime. And then for your post-treatment sample, you want to collect the manure from ideally the same cattle 14 to 21 days later. Now there's a range and there's a time range for your post-treatment sample, and that time for your post-treatment sample will be dictated based on the class of dewormer that you use. So for the benzimidazoles and imidazothiazoles, They're shorter acting, so we generally recommend the post-treatment sample to be collected around 10 to 14 days later. For the ivermectin and avermectin group, and that's in that macrocyclic lactone class, they're generally recommended to go back 14 to 17 days later. And then our moxidectin, which is also in the macrocyclic lactone class, we will go back 17 to 21 days later to collect a post-treatment sample. Some of that seems a little bit like specific and what have you, but again, this is just to ensure you get the most accurate assessment possible. And then again, you would repeat the manure collection and compositing steps as you did before, and then you submit the sample to the lab. So what you will get back from the lab is a report that says number of eggs per gram of manure that you submitted. And what you do with those numbers is you take the difference between the two, so the pre-treatment eggs per gram minus the post-treatment eggs per gram, divide by the pre-treatment eggs per gram, multiply by 100%, and that will give you the percent reduction that you saw. And what we do with those results is we look at them and we say, oh, you know, it was effective, or no, it was ineffective. The threshold that we like to use for an effective treatment is 95%. Anything less than 95% is considered to be have reduced efficacy or developing resistance. So anything less than 70% is considered highly ineffective. 90 to 95% reduction is kind of a gray area. It's we suspect that there's resistance in that case, but you know, a bit of error associated with that. So 90% of efficacy may seem like it's not very, it might seem like that's pretty good, like 90%, but actually it's not really low enough to produce, you know, it's not really low enough to produce noticeable issues with performance, but it does have implications for the development of resistance. So if you think about it, that means you're still leaving 10% of the worms in the animal that are resistant, and they can proliferate over time, and that's, you know, that's how the story goes. So in terms of what you need to conduct your fecal egg count reduction test, obviously you need a way to restrain your animals safely, so you're not, you know, going to get kicked or run over or anything like that. If you have no way to restrain your animals to collect an individual sample directly from the rectum, you can just wait for them to defecate and collect the manure fresh from the ground, as long as it's not, you know, been sitting out in the hot sun or anything like that. You obviously want to have some gloves on hand, some containers or Ziploc bags or anything like that to put the manure in. You want a small scale for weighing the manure, so you're ensuring a equal representation from every animal in that composite sample. Obviously, you want a container for mixing that sample, that, you know, big composite sample together. I like to use large, you know, solo cups or anything like that would work fine. And you obviously need a mixing utensil. Disposable ones are great. I don't recommend using your things from your kitchen. And then you obviously need some shipping supplies. So some of the drawbacks for the fecal egg count reduction test is that, as I mentioned a couple other times earlier tonight, shedding of eggs and manure is highly variable from animal to animal. Time of day can have an effect, season, as well as the species of worm can actually affect the parasites that are shed in the manure. Some worms, like the Ostertagia or the brown stomach worm, don't really produce a lot of eggs, so it can be hard to detect an infestation sometimes with those worms. And then egg counts obviously don't tell you what species you have. The lab is just counting the number of parasites in the manure. So it's not a perfect test, but it is what we have, and it is fairly simple to implement on farm. And again, as I mentioned earlier, composite testing has a little bit more error than individual testing. And the results can only be interpreted for a group of animals, not an individual animal. For obvious reasons, you're sending in a sample that's representing the group, not the animal, the one animal itself. So some final tips and reminders. So there are 3 components of a good parasite management program. That's ensuring our animals are healthy and well fed. We want to make sure we're practicing good pasture management. And then we also want to practice judicious dewormer use. That last point, using dewormers, should be used as a supplement to the parasite management program, not as the only piece to the parasite management program. Okay. And we want to make sure we're utilizing selective deworming strategies wherever possible to help maintain that Refugia population to reduce dewormer resistance development. We want to avoid deworming by the calendar. We want to make sure we're weighing our animals before we're deworming so that we know how much dewormer to give them so we're not underdosing. We want to make sure we're looking at label instructions carefully. We want to evaluate the program periodically to ensure that it's working. And if there's signs of reduced efficacy in a dewormer, then we can change to a different dewormer or utilize some sort of combination treatment. And with that, I just want to end by saying that our extension team was just awarded a research and education grant from Northeast Fair. And it's focused on parasite management. And we're looking for equine, dairy, and livestock producers in Maryland who are interested in working with the extension educators to improve parasite management on their farm. This program will involve one-on-one consultations. We'll come out, we'll evaluate your current practices, and then we'll conduct a fecal egg count reduction test, show you how to do it, and then we'll develop an individualized parasite management plan for you. So if you have any interest or you think you know somebody else who might be interested, please get in touch and we'd be happy to discuss a little bit further. So with that, I'll take any questions if you guys have any. If not, thank you for